This is an Eye on Annapolis bonus podcast.
Once again, we're up here at Evolve Direct Primary Care and Urgent Care on South Cherry Grove Road with Dr. Michael Freedman. How are you today?
Lovely. Good morning.
Good. Well, hey, first of all, first things first, thank you for the drive-in flu shot clinic the other week. I pulled in, took me all of about 45, 50 seconds or so, and I was on my way. So I was
perfect.
It was absolutely wonderful, and I will say that last year was my first year of getting the flu shot ever in my life, and that was purely because I had convinced myself that I was going to get COVID and the flu at the same time and just die.
Exactly. This is a good year to get your flu shot.
So, and also thankfully I did not get COVID nor the flu last year, so I'm hedging my bets this year, and I just recently got my booster on your recommendation on the Pfizer down at CVS, and after a stiff arm and a day of being tired, like I haven't been tired in forever, I'm feeling pretty good, and hopefully I'm protected and protecting other people. But wanted to really talk a little bit about COVID. And I mean, you are not an immunologist.
Correct.
And if I pronounce that right, that would be a miracle, but I think that's it. But you are a medical doctor, and you are sitting here seeing the results of COVID from
Correct.
A different angle here.
Yeah.
But I mean, what have you seen in your practice here?
We've definitely seen a lot of people coming and testing positive for COVID. Most of them vaccinated. Most of the folks that we're seeing were vaccinated because there's a high vaccination rate in Maryland. But we're also seeing a lot of people that are unvaccinated who then test positive for COVID, and it's a little scary, to be honest with you, because it's one of those no atheist in a foxhole situation. You can espouse any kind of freedom and say a lot of different things, but when you're sick and your spouse is sick and your children are sick and you realize it was preventable, and it just kind of pops in your head that I didn't necessarily need to be here and be worried about everyone potentially dying, or having to go to the hospital.
I mean, the odds are not the odds, but the risks are great. If I get the flu, the chances are, that I'm going to shake it off in a couple of days. And this is a little bit different. I mean, because this is, I know I've talked to some people that we'll say the anti-vaxxers, and not necessarily in general just saying, oh yeah, but it's just got this survival rate. And I'm like, well, that's true, but you look at the amount of number that are infected.
Right.
I used to be in the travel business, and it was like, how bad does a trip need to be to justify a cheap trip?
Right.
I mean, what is your level of risk to sit there and say, 1 in 1,000 or whatever, I don't know what it is, but what if you're the one? What if your kid's the one?
Yeah, and it's much higher than 1 in 1,000. It's a few in 100. And although we do know that certain people are at higher risk, and those people, whether they have health conditions or their age or whatnot, we are seeing people die in their 20s, 30s, and 40s here at Anne Arundel. Our local hospital, we're seeing some of these people dying. And in my mind, it's like playing Russian roulette, and I don't know how big that chamber is. I don't know how many bullets are in there. But if you give me an option of playing Russian roulette or not playing Russian roulette,
it's
especially if it comes to my kids or my spouse, I'm not going to put a gun to their head.
It's a pretty easy choice. Well, what are you offering here for your practice? I mean, do you do testing and vaccinations in the whole 9 yards, or do you just...
Yeah, so we do. We only do the COVID PCR. We don't do the rapid testing here.
Okay, PCR. That's the stick it up your nose.
Yeah.
Okay.
Yeah, we have like a drive-through in the back, and you can just drive through. We shove something up your nose, and off you go. We get the results back the next day. For a long time, we were seeing a lot of testing, and that really has dropped off, which is nice. But then we are seeing a lot of testing for travel or schools or exposures where the people are fully vaccinated, and we're expecting to see, a negative result, and we're seeing unexpected positives. So There's definitely plenty of COVID out there in the community. Once the Delta variant hit, it's just so contagious. The difference between, COVID version 1.0 and
Well, you mentioned Delta, and I mean, Delta seemed to be a big newsmaker, and it was portrayed to be, and part of the frustration on the people is like, I think Dr. Arlotto in the school said, we're building this plane as we fly it. And to a degree in the medical thing, I think we are as well. I mean, people say, well, Fauci lied. I'm like, well, Fauci didn't know what he knows now that what he knows now.
Yeah.
And I mean, but Delta was sort of hyped to be this, I hate to use the term, this killer variant that was going to sweep the world, and this was the doomsday thing, and it somewhat seemed to fizzle out. I mean, obviously it was here and stuff like that, but I mean, are variants still an issue?
Yeah, variants are a big issue, and so basically the Delta variant is 87 or 90% of all of COVID cases in the country now have all become Delta. And what happens is the virus will mutate over time, and eventually it will find a mutation and makes it either more contagious, you can transmit it much more easily, or it will make it such that you're spreading virus for a longer period of time. Usually it doesn't necessarily make it more deadly, because that works against the evolution of the virus, if you think about it, because it doesn't want to kill you like Ebola. If it kills its host, then it has to go find something else, and the virus can't keep replicating and making more of itself. I'm just getting this flash in my mind of Dr. Evil somewhere, trying to, no, we don't want to kill them. We just want to make it really miserable for them so we can continue to do it. Exactly.
So it's really an insidious virus that I guess any virus is that. Yeah. I mean, it's just fairly standard across the entire viral world, and we're going to keep getting variants because every time the virus infects someone else and starts replicating itself, there's typos, there's little mistakes, and some of those will eventually confer a stronger, that virus that's not as sensitive to our current vaccines, or it will make it more contagious, or something that will allow it to spread more predominantly, and it will become the predominant version of the virus that's around. Do you see a future of America and the United States with COVID booster shots on an annual basis, similar to a flu shot type of a thing, or do you think we're ever going to get this thing eradicated?
It will never be eradicated, most likely. It will be with us probably, forever. But there's other COVIDs, other coronavirus vaccines, which have been around forever that cause the common cold. And this is just what happens when you find a version of a coronavirus that is new to all your antibody receptors, and just your body hasn't seen it before, and no one has seen it before, so the entire population has to learn immunity or die, or get vaccinated. Those three choices.
And I've also got to think that just the body makeup of everybody is so unique, whether it be the DNA or everything else. I mean, we've talked a little bit about the different side effects from the vaccine, the different levels of severity when you have COVID. I mean, some are like, oh, I had it, I guess I did. And others are obviously on a ventilator and passing away in hospitals. I know. My mom smoked 4 packs of cigarettes a day for 40 plus years. When she died, there was not a hint of anything in her lungs. The only brown thing that we found was like the nicotine on the walls of her house when we sold it. So it's just very weird. You never know how somebody is going to react to that.
It's like
is that what you're finding?
Yeah, the Keith Richards phenomena.
Yeah. Wow. How is that?
I can't imagine.
Those memes, by the way, off topic, those memes on Keith Richards are just fantastic. It's, it's like the 1920s or 1920s, that's when he was born, crying out loud. Him in the 1800s, it's like, oh yeah, and there's Keith Richards' kindergarten picture.
Right.
We're recording this right now on Saturday the 30th, and the FDA just green-lighted the vaccines for ages 5 to 11 for the little crowd. And I think we're just waiting sort of a CDC sign off. And I know that the health department here in Anne Arundel County has said that they're going to be, as far as vaccinations in their clinics, they're going to be prioritizing that 5 to 11 crowd. What do you say to parents with 5 to 11 kids? And are your kids in that?
Just outside. My daughter just turned 12 last week, so we're actually 4 days ago.
Okay. Congratulations on surviving that. My condolences on entering the teen years.
Yeah. But, for parents with kids that were 5 to 11, you have this, these kids, everyone else is vaccinated in your family and safe to go to, restaurants and go on a trip. And you felt like you could, get on a plane and not be concerned that you were going to get COVID and potentially die, before you get back from the trip. But you had, one person in your family or, a few people in your family that were the younger ones that weren't vaccinated. Plus, even if they didn't get terribly sick, they were bringing it home, to pass on to grandparents who were still worried. So I think that it's going to be a big relief to be able to give it to the 5 to 11 crowd. That said, I haven't looked at the data enough because it just got authorized, the EUA for the 5 to 11, and we haven't had the CDC chime in yet.
Right.
But I think we'll have a lot more information in the next few weeks.
Do you think there's going to be a resistance to that? I mean, right now we've got a core group of people resisting the vaccine. It's I've got the right, my body, my right, and the whole 9 yards there. I mean, do you find that you're going to have the resistance because, again, and you could argue that it's a rush vaccine. I mean, it was a rush process to do it compared to all of the others. It doesn't mean that it's any less effective or good or the science wasn't in there. But we've got about 30% of the population nationwide that is kind of resistant to that. And you look at the you look at the EMS and the fire and the police. I mean, they're talking in New York about firing a third of their cops because they're refusing to either give the information or get the vaccine.
Yeah.
Do you think there's going to be a resistance for parents to do this, or should there be?
So I think that's a very different kind of resistance. I think that a lot of parents, myself included, would be cautious and want to have more information, more data, and understand a little better the effects on kids beyond that first day that you can get them. And the difference being that we knew, for you and I, John, that like when the vaccine became available, we were jumping on it because we didn't want to get COVID and potentially, be leaving out of Anne Arundel in a refrigerated truck out back.
Right.
Kids, 5 to 11 tend to do well. So the risk benefit, of the vaccine versus the disease, it becomes a little harder to calculate that number, or it becomes more important that you pare down and have a clear understanding of what the risk is and what the potential benefit is. Yeah, I know that surveys show that there is a lot.
You didn't know we were going into a game show here.
Yeah, there's a lot of people that really want more information and are a little reticent to proceed.
And I can see that. I know when they were just first talk about the vaccine coming out in October. This 2020 is like a year that doesn't exist in my mind. It's just like an eraser thing.
Yeah.
But when they first started talking about it, that they're getting close and they're doing that. I mean, my position was I don't want to be first in line here.
Yeah.
Let's let a couple other suckers get in there and figure out how that is. But as it became available to the seniors, and as we begin to realize that and everything else, as soon as it became available to my age, as were you, it was just like, okay, yeah, I'm going to go do it.
Yeah. And, most people in healthcare, the vast majority of people in healthcare that, have studied this kind of stuff, it was really a no-brainer because we all knew we were falling from an airplane. And so when someone came flying over with a parachute bag, yeah, I mean, maybe it's from China, maybe it's from, but I didn't really care who stitched it and, was it the most solid, parachute? I knew I didn't want to hit the ground without one.
Yeah. You talked about most medical professionals and people in the industry knowing now. I know that Irish Krasnow just wrote a column in the Capitol talking about an experience at Anne Arundel Medical Center in the Sajak Pavilion. And it was secondhand. It was from a friend of hers that went into a doctor's office and asked the receptionist who had the mask underneath the nose, said, is vaccinated. And the receptionist said, we don't talk about that here. And then she witnessed them all in the back talking about what the doctor comes into the exam room and says, well, I'll get this out of the way if you're going to ask. No, I'm not vaccinated.
Oh.
And she got up and walked out. And now this is Iris telling the story in the Capitol from a doctor. And the response when they followed up apparently is that at Sajak it was that's essentially a landlord building, as opposed to they're not necessarily associated with the hospital. They're just renting the space, and
Correct.
They can make their own positions and their own rules and regulations, and don't fall under the hospital. But what do you say when a medical professional, and obviously I'm presuming this is not a general practitioner that may be treating COVID. This may be an oncologist or a gynecologist or something like that. But what do you say when just a medical practitioner, which has certainly an awful lot of common education that you have, that Fauci has, that says, yeah, no, I'm not vaccinated?
Yeah, I've had that rarely, very rarely, and I usually will appeal to that individual's because there's science. There's
what the hell?
that's I'm tempted, but no, I mean there's science and there's facts and there's a scientific method and there's knowledge. And there's people that should be living in the world of science and knowledge. You really should not be in healthcare practicing medicine in any kind of a way if you don't believe in science or knowledge. And most of us are trained not to practice anecdotal medicine. You can go to your grandmother for that.
Right.
She's going to tell you, oh, chicken noodle soup is great, and and a lot of those things are great. But you want to know what the science says, how things are tested. What does the data tell you? It's surprising to hear that. I hadn't heard that story.
Yeah, it's in the Capitol the other day. I was shocked to see it too as well. And I mean, what sort of struck me in that, are you vaccinated? Is like how are you doing question anymore.
Yeah,
it seems. I mean, you would never think 10 years ago, oh, got BD?
Yeah.
I mean, you don't have cancer, do you? Or eczema, or any just wouldn't go that.
Yeah.
But here it's like hey, are you vaccinated? Okay, we can be friends. We can we can talk.
Yeah.
And it's COVID has really upended the world on any number of different ways.
Yeah.
I know that I still see people and they're like, I know that we're all fully vaccinated, and you go to shake hands as we did when we started here, but they're like, yeah, no, here's my elbow.
Yeah.
And I'm like, okay, now I'm thinking, maybe should we shake hands? Should we be shaking hands or not?
I'm careful if I shake hands with someone. If I touch someone in any way, shape, or form, I use a hand sanitizer at some point before I touch my face.
Right.
Before I put my hand in any kind of an orifice, eyes, mouth, nose, whatever.
Patient.
Yeah, hopefully. Yeah. We really do know it's respiratory transmitted, but if someone has just coughed on their hand and they come in and, or wipe their mouth, you do things subconsciously that you don't think. And
right.
It is potential that you can spread it that way. I do feel better about my situation and your situation having had the boosters. That is another layer of reassurance.
Well, I know that I've been washing my hands a hell of a lot more than I ever have in my entire life.
Yeah.
Over the last 2 years, and it's a good thing. It's a good thing. I mean, there is a little jug of hand sanitizer in the central console of my car, so I mean it's there when I do different things. You mentioned boosters. Let's talk about boosters. Okay, I did get the Pfizer booster on my Johnson & Johnson shot on your recommendation, and the general recommendation that we're hearing from the CDC is if you can get a booster, get it, and doesn't matter what it is.
Correct.
And right now it's Moderna and Pfizer are the only approved boosters, correct?
No, J&J is approved too.
Oh, they have okay.
Yeah.
So there are 3 approved boosters.
Yes.
And do you recommend if you need a booster and want a booster, get any booster?
No.
Okay.
So I don't recommend J&J. And the reason I don't recommend it is that there's been more adverse reactions with J&J than there have been with Pfizer and Moderna. And there's some studies that have showed lower immune response over time. And probably the J&J needed to have a two-shot booster after 2 months. all along, but they really wanted to do the one and done approach. But the studies do seem to show a more robust response if you had J&J, then you get an mRNA booster like Pfizer or Moderna.
Okay.
And so if you had, say, Pfizer or Moderna to start with, I'm recommending that for the most part you stick with Pfizer or Moderna the same for the next booster. And part of the reason is that you know that if you did okay with the first 2 shots, you're probably going to do okay with the third one. Whereas there's a slightly higher risk of, introducing something slightly different. And it doesn't look like the difference in immune responses is significant between getting Moderna over Pfizer or Pfizer over Moderna, mixing and matching in that way.
Right. And again, I'll just reiterate, the process of getting the booster shot was a hell of a lot smoother as we're learning more how to do it than it was to get the initial shot.
Yeah.
I remember when the first initial shots came through, it was, I was on the keyboard at 2 a.m. tapping away looking like, look, there's one in West Virginia. Do you think I can, I can make it to there? And this time, we went to, I went to your website, which is evolvedmedicalclinics.com, and there's a very robust COVID section. And you can go from a link right there. It takes you put in your zip code, you select which one you want, and then it tells you all of the places that have it in stock.
Yeah, it's amazing. I mean, you say, here's
and has appointments available.
Yeah, here's my zip. I'm willing to travel 1 mile, and 50 locations come up.
Yeah,
with appointments available that day. It's really stunning.
And it really is. I mean, CVS, had the Pfizer for me, and it was within walking distance to my house. I mean, I signed up. I could have had one the next day, but it was like, okay, it's the weekend, so I went for Monday morning. Easiest process in the world, in and out in 15 minutes, and get the booster if you can. Go on to, again, evolvedmedicalclinics.com. There's a COVID-19 page that has all of that big button on there. It says, find a vaccine near me or something along those lines there. What does the flu season look like this year? I mean, I know last year was very light because everybody was masking up and hunkering down. Yeah,
everything was very light. I mean, when we were just talking about handshakes and all that sort of thing, we saw, it seemed like, people didn't get sinus infections or, there was just a host of things. We didn't see a lot of common colds and all the usual stuff that's getting passed around. Those things are coming back in a big way.
I would imagine that the flu vaccine, which also sort of has to be revised. I know this is where I learned from you the first time we talked, is that it's revised yearly based on what the strain was the year before.
Correct.
So I imagine with a weak flu season last year, our vaccine may even be a little bit off.
I wouldn't necessarily say that. I don't think you could go to that conclusion. I think that you never really know what the flu season's going to look like. There's, at least to my knowledge, there's no farmer's almanac for predicting, because it's slightly mutating from year to year, and we don't know if it's going to be a bigger mutation that has some kind of more dramatic effect that makes it more contagious or more deadly or more, illness causing, where you're just really out for 10 days. And it's a little early in the season yet. It starts to pick up around November 1, mid-November, and then peaks sometime usually in January, February, and peters up in March, April.
Again, last year with COVID, I mean, we were housebound.
Yeah.
Don't go to grandma's for Thanksgiving. Right. Don't go, order Swanson's TV dinner for your Thanksgiving.
Yeah.
And this year, it's not the same. But we do have the Delta variant that you said is the predominant variant that's around here for COVID. We haven't seen a huge drop in the numbers, I don't think, as far as that are getting it. And I've been doing this geeky tracking thing on just an Excel spreadsheet of the cases worldwide, cases and deaths worldwide, U.S., Maryland, Anne Arundel, Virginia, and D.C. Mm-hmm. And the number of new cases a day hasn't dropped precipitously with the vaccine that's out here, which tells me that either we're getting all of the unvaxxed people or there's a lot of so-called breakthroughs that are coming through there. And the deaths have not... they've reduced, but it's not what I would have kind of expected with this vaccine or maybe the hype of the vaccine. But do you think we're going in for a tough winter again?
So as far as the breakthrough deaths with vaccine, they're very rare still. I think there's a total in the U.S. of 7,000.
Oh, wow.
And that's, since January of 2021 when, the vaccines were really rolling out. And so it's really rare. And in that setting, they're almost all people that are over 80. They're otherwise very immune compromised, bone marrow transplant folks, people are on immune suppressive drugs, the folks that are the most angry at the people who aren't getting the vaccine because, they're the ones that even if they get the vaccine, it just doesn't have as robust a response. But the death rate or the number of people that have died just in the last few months is over 100,000. But you may not be seeing it if you're tracking Maryland, D.C., Virginia, because it's almost all in the South. Like if you look at the right. map where all the deaths are occurring, it's Texas, Louisiana,
Florida,
yeah.
And they've got a number of different. I mean, they've got a low vax rate. They've got the politics that are into play there, as well as certainly in Florida, the aging population, which has a thing. Yeah. Plays into that as well. And
it seems like there's. Really, it does come down to the vax rate, being 30-40% in some of those areas versus Maryland, I think, is at 68%.
Yeah, we are. Do you think generally, looking on a state, a county, and a city level, that we've handled this as best we can?
I think Governor Hogan has done as good a job as you can possibly do. Kind of back to what you're saying about Fauci and, he said the wrong thing, 18 months ago. And, I'm sure Hogan, all of us have made missteps because we didn't have all the information. And it's actually not, the good sailor that keeps heading towards the rocks. You identify, you get a little closer, you're coming through some fog, and you realize you're coming up on some rocks. It's time to tack and go a different direction.
Right.
It doesn't mean that you made a mistake in the first choice, but you have to shift and move as more information becomes available.
Adjust to where you are.
But I feel that Maryland has done as good a job as anywhere else in the U.S.
That's good to hear and encouraging.
Yeah.
Do you encourage people to? I mean, I know in the city they're ending it. The outdoor dining, the county has extended it through January of 2023.
Yeah.
So they've given restaurants in the county the ability to have the outdoor dining, the tents, and everything else all through next year.
Yeah.
Do you recommend people when they're going out to dine to still continue to try to keep that distance and eat outside if you can? And
yes.
Okay.
Yeah, I definitely do. The transmission rate outside is so low. It really is much, much safer. And to eat, you can't have a mask on. So I think that it's a safer choice.
Makes sense. All right, and as we wrap up, I am going to be speaking with Jim Gavoni with Hardesty Funeral Homes, and he had told me on the phone that I was just sort of questioning about COVID and the deaths and stuff like that, and he said there's an awful lot that he's dealt with, and there have been outbreaks that have happened at funerals and viewings and stuff like that. But he said by far the biggest increase that he's been seeing is suicide. Over the last period of COVID, I would say last year, but it's been with us for more than a damn year. So. Yeah. And obviously this has taken a mental toll. I mean, I look at, some of the elderly when it was like, okay, well, where's grandma? She's trapped on the 6th floor of this building in this room that she hasn't left in 6 weeks.
Right.
There's a mental toll on that. Not seeing your loved ones, not being, are you a social creature? I can't get out and I can't socialize. I can't get in your personal space and everything else. I mean, are you finding in general in your practice, are you seeing more depression and more mental issues that are coming through?
Absolutely. It's really awful because there's a psychology to surviving something like say World War II. You go through a tough campaign and then there's kind of an end time to it of some sort. And when you keep getting pulled back into it, when you think you're just about done, in July the numbers were going down.
Yay.
So people were like taking off masks, and this is, it felt like we were going to hit the end of it. It was going to be the roaring 20s of no concerns anymore. And then suddenly there's another surge, and it's been really tough, and particularly in the younger people, adolescents that didn't go to school for a year, or
It's gotta be brutal for them.
brutal. I mean, they missed a whole year, and the teachers, have had a lot of stress. Managing that virtual schooling and now being back in school with kids that are, kind of a year behind on everything. A lot of kids, didn't see a friend for a year, and there's still a lot of trepidation about, getting together, much less so for them now, but there was all that missing social gatherings. And
Do you have any kind of suggestions on how to help that, maybe to knock that curve a little bit? I mean, if you suspect somebody is having some kind of an issues, I mean, it's a very fine line to, is that an invasion? I mean, typically I would go like, hey, Mike, are you doing all right? I mean, I just saw this. Are you worried about it? And you might get all defensive and everything else. But I mean, is there something that we can do as a society? Because I mean, it's a problem. I mean, it's if this is a side effect of COVID, it's something certainly that a vaccine's not going to cure, and that we're going to need to figure out how to handle.
Yeah, I mean, and I think it's broader. The news channels on both right and left side, and Facebook and social media, they traffic in fomenting anger and generating responses from their population they're trying to market to. But it's all that negativity that I think is not helpful. If you sit down with someone and just listen to them, let them talk, and I think that people will start to eventually open up and share things. And if you can, the most important thing is get them in to see a counselor, help guide them to find somebody.
Yeah, I know Anne Arundel County has the Crisis Response Center, which is Crisis Response Team, which is a great asset. Mm-hmm. And I don't have the number off the top of my head, but I'll put it in the show notes. But if you're in crisis or something like that, these folks are trained to come out and talk to you and figure out a way and to get you help.
Yeah.
And that's just a great asset. I know former county executive Shu instituted that, and it's been recognized actually globally, not just as what they do. I mean, it's
suicide is so tragic because it's a permanent solution to a temporary problem, and for all of those of us who are left behind, we're sitting there saying, it would have gotten better, and even those who have been suicidal or attempted suicide who survived, down the road, they're like, realize it gets better. We just are all going to go through tough times like that. And you just have to kind of, sometimes it's just put one foot after another and plod through and
see how it comes out on the other end. And certainly the employment situation isn't helping, when folks that have been unemployed or unemployable or just for whatever reason unable to return to work. I mean, have you found in your practice, I don't know whether a medical practice, I mean, is getting employees tough for you as well?
Oh my gosh, yeah. Yeah, it's been really, really hard. And we've had to pretty dramatically increase pay and benefits to try to retain the people that we have. But the good news is by doing that, I feel like we've really gotten the cream of the crop now. We've got some really great people.
It's interesting. The new restaurant that's coming down where Fawcett's is the Chop Tank, which is a part of a chain, but based out of Baltimore. And the CEO decided, going into the pandemic, he had said that when we close down these restaurants, and Baltimore was open and close for a period, he says, it cost me $30,000 just I can write that check the day he says you're closing, because that's what's going to cost me to reopen it again by the time I pay for my spoiled food and my staff that I need to keep on, rehiring and everything else. They've taken a policy now. They said that everybody that works for them will be making a minimum of $15 an hour. That's their minimum wage, which is, we're moving in that direction.
Yeah.
But he says, no, this is the dishwasher, this is the busboy, this is the hostess at the hostess stand, and this is the server that's not making $3.35 an hour. I said, now they can come into work and know that they're going to be making a fair wage, not have to worry about, is it going to be a slow night? Is it raining and nobody's going to come eat and everything else? And I think that's interesting. And it'll be interesting to see how the whole tipping situation works.
I think that's a brilliant move on his part, because I know, having been a waiter myself and, worked at Fridays and some other lousy places at times, no offense to Fridays owners, but, as far as, you have like a few tables of two that are hanging out all night, right. Sharing a one order of wings, and you get a tip for like $1.50.
Or like here during the sailboat show, and you get 10 to come and say, we'll just take a water.
Hanging out.
We promised to be out of here by 1.
Right.
Fantastic. Well, this, as always, has been very insightful. I thank you very much for your time, for coming in on a Saturday morning and
always a pleasure
talking with me. And keep healthy for everybody. Get that booster shot. I guess that's definitely the biggest thing out of here.
Definitely.
You want to go to evolvemedicalclinics.com and go to that COVID-19 page. You want to check out the resources that they have there. There's some very sound reasoning. I know that. You're clear on like, hey, I don't recommend, or I do recommend this. The CDC currently doesn't, and here's why.
Right.
Which I think is very important. When you're talking, why, what's the reasoning behind it? So,
and I usually try to tell you who I'm quoting from. It's usually like some Harvard or Stanford immunologist, in several groups.
This is those second-tier schools, right?
Yeah, that's right. Sometimes I have to slip down those levels.
Can't you get like AACC or something like that? But although AACC does have one of the best nursing programs in the country.
I was going to be like, don't drag me into that.
So, Dr. Freedman, thank you very much.
Yep, my pleasure.
This has been a bonus podcast from Ion Annapolis. Please visit us at ionannapolis.net. Follow us on Facebook at All Annapolis and on Twitter at Ion Annapolis. And if you haven't subscribed to the Daily News Brief podcast, go for it. And all of your local news will be delivered to your phone, tablet, or smart device by 6 a.m. every Monday through Friday.